Hello everyone. The next topic I'll cover in the developmental disturbances in the oral and paraoral structures, that is the developmental disturbances of gingiva. I'll discuss two disturbances, that is fibromatosis gingiva and retrocuspid papilla. First one is fibromatosis gingiva. This is otherwise known as elephantiasis gingiva, hereditary gingival fibromatosis and congenital macrogingiva. These are other names for fibromatosis gingiva. It is a diffuse fibrous overgrowth of the gingival tissues and it is transmitted through an autosomal dominant gene. What are the clinical features of fibromatosis gingiva? It is more dense, more diffuse, the surface is smooth and there is a nodular overgrowth of the gingival tissue. In the clinical picture or in the diagram, you see there is a diffuse growth. There is not a localized growth. The growth is present everywhere in the gingiva. It is diffused and it is not inflamed, and the color of the gingiva, it can be normal or it can be pale in color. Pale, that means lighter than the normal color of the gingiva. The normal color of the gingiva is coral pink in color. This diffuse enlargement is not painful and shows no tendency for hemorrhage or no tendency for bleeding. Then histopathological features of fibromatosis gingiva, or what are the microscopical features? This is fibromatosis gingiva, that means there is a hyperplastic. So the epithelium is thickened. You can see the epithelium, it is thick with elongated reticle. The bulk of the tissue, which is composed of dense fibrous connective tissue. The connective tissue is more of collagen fibers and some of fibroblasts and some amount of blood vessels are there in the connective tissue. Then the treatment plan for the fibromatosis gingiva: when there is a tooth eruption is impeded or there is an obstruction to the tooth eruption, there should be surgical removal of the excessive tissue and exposure of the tooth is indicated, and the cosmetic appearance requires surgical excision. For aesthetic purpose, you can surgically excise the excessive tissue. The second developmental disturbances of gingiva is retrocuspid papilla. So retrocuspid papilla was first described by Hirschfeld in 1933. Clinically, it is a small elevated nodule which is located on the lingual mucosa of the mandibular cuspid. The name itself suggests that retrocuspid papilla, that means it is present retrocuspid, that is behind the cuspid. Cuspid is also known as canine. It is present the lingual surface of the canine, that means retrocuspid papilla. It's a projection or nodule which is present behind the canine, that is lingual surface of the canine. So clinical features, what you see clinically, it is a soft tissue. Okay, in the picture you see there is a small nodular growth which is soft and which is well circumscribed, and it is sessile, and mucosal nodule which is present bilaterally and present lingual to the mandibular canine between the free gingival margin and the mucogingival junction. Histopathological features of retrocuspid papilla, that shows hyperorthokeratosis or hyperparakeratosis. In the picture you see there is hyperkeratinization. That hyperkeratinization can be hyperorthokeratinization or hyperparakeratization with or without acanthosis. The connective tissue, which is more vascular, more presence of blood vessels and presence of fibroblast and epithelial rest. Coming to the treatment plan for retrocuspid papilla, because of its frequency of occurrence, the retrocuspid papilla is considered to be a normal anatomic structure which regresses with age and require no treatment. So these are all about the developmental disturbances of gingiva, and I will discuss other developmental disturbances of oral and paraoral structures in my upcoming videos. Thank you so much.